This is Jeff Breedlove in conversation with Representative Sharon Cooper from the great state of Georgia. Representative Cooper, you're a true leader in the General Assembly. Thanks for taking time out of your busy schedule to join us today.
Oh, well, thank you very much for asking me and for that compliment. I'm always glad to help. This is an area of special interest for me.
Well, tell us, two things as we get started. Tell us a little bit about Sharon herself, the person, and tell us about Representative Cooper and what drives you in the General Assembly, and a little bit about your district, because this is a national podcast, and folks may not, know where your district is.
Okay, about myself. I'm a Texan by birth and became a Georgian by marriage and have lived in Georgia the longest time. And I'm now a widow and I love Georgia, especially the trees. Where I grew up in Texas, we had a lot of pine trees, but in Georgia, we have a big variety of trees and I like all the season changes. I grew up, and at the time I was growing up, women had, three choices. Basically, we were either nurses or teachers or legal secretaries. I went the nursing route. I have a master's degree in nursing. I also have a master's degree in education in teaching other people how to teach. And not only did I work as a nurse in several areas, but my first job out was in mental health at a big state hospital. And, right there as a new graduate, it sort of got my interest in what was going on and how backward it was. And so when I went back for my other degrees, I sort of specialized in psychiatric nursing and psychology. So that's part of me as far as education goes. But I'm also been in the General Assembly, I can't believe it, but 30 years. I
Wow.
spent 8 years in the minority and have been in the majority since. Chair one of the health committees. Didn't mean to run for office. Was unusual for women my age. Just happened to get interesting over Hillary's health bill. It was too progressive for at the time, and even Reader's Digest, the beloved Reader's Digest, said we didn't need it. It was too much of the Canadian model, and my husband was a physician, so I started helping on campaigns, and then all of a sudden, somebody pushed me, and there was an open seat, and I ended up in the legislature. That's it.
Now tell us where your district is. What type of district is it? Is it urban,
Okay.
suburban, rural?
My district is East Cobb. It's in the city. It's not in the city, but technically it's in Cobb County in Marietta. My mailing address is a Marietta, Georgia address. But I live in East Cobb. We sort of say that there are two parts of Cobb County. Marietta is the older part of the city. It's a beautiful little city. They've done a great job in attracting young people to come to the city and enjoy the square. But I live on the other side. And basically, East Cobb is a bedroom community. There are very few businesses. Only in the last few years have we had sort of an interesting shopping center that went in with all sorts of stores, and my favorite, a bookstore. So that made me happy. And so basically, my district is extremely on the scale, probably one of the more wealthier districts in the state, and people are highly educated. Many with a master's degree or above. We have a lot of retired military, more in the officer base than some of the other districts. And basically, a community or a district is very community minded. Not a few years ago, we started the North Georgia Elder Abuse Task Force, and we have really, by volunteers only, really made a difference in teaching people about elder abuse. And that included all over North Georgia, sheriffs, and not only the elderly themselves, but the district attorneys and the people that worked in there, because really they thought elder abuse was like child abuse 50 or 60 years ago, when people said, oh, that's just parents, they keep your hands off. So I'm very fortunate where I live. And then I got there are two lots that makes it look like I'm in the North Georgia, that you're in the North Georgia mountains, and I have one of them. So all wooded. However, I am on this Zoom because I drove to somebody's office to do it, because not only is it wonderful with a great big string running through it, and where I hear the it goes over rocks, so I hear it from my house, from all the doors and windows in my house, but it's wooded, and technology has not reached my house yet. So
Oh, well,
a little bit about me. Sorry if I went on too long.
no, that's wonderful. I mean, you have a beautiful district.
Well, I'm not used to talking about myself, so
There you go.
and that's
Well,
what, I don't usually have that question, but that's great, and that's me.
but that's part of in Georgia, and I'm sure in other states, a lot of the elected officials are not full-time elected officials. They're citizen legislators, and you have an educational background that is a blessing to our community. And let's talk bluntly about your district for a minute. I mean, as beautiful as it is, and as nice as it is, and they're all great Americans. We know all that stuff. But in terms of the addiction epidemic, I was in treatment with a Delta pilot. I was in treatment with a heart surgeon. There were CEOs, there were CFOs. These were white collar, very successful folks that would live in an affluent district, and I was frankly, and there was some college students from families that would live in a district like yours, and it has occurred to me that those are families sometimes that have the money to buy the drugs. They may not be selling the drugs, but they're buying the drugs. And there may be lots of reasons why they're doing so. But, the addiction epidemic looks different in different parts of the nation and different parts of a state. What have you seen? How has it manifested itself in your district from a practical point in your community?
Well, it gets very personal for me. I'm a second wife. I have no children, but my husband had 2 daughters. And I think Margie now is 54. So this was time ago, and her sister was older. And people at the time, Tom tried to tell him, as a physician where she went to high school, and a very good high school in my district, that they were having a problem with alcohol, and that it was really a problem, and with marijuana at the time. And they didn't want to believe him. And some people can get over their addiction. Betsy never did. And she died at, let's see, about 3 or 4 years ago. And she died from drugs and alcohol. So it's personal to me, and it's still going on in my district. It is well to do. The kids often drive to school at one of my high schools, or, very expensive cars. And there is money to buy drugs. And that there's still a denial. Now, with adults, I would say that they just keep it quiet, because you really don't hear that much about it out in the district. Here again, it's a bedroom community, so it's not like some of the districts where they have towns in them and everybody knows them and everybody knows everybody's business. So if you're older, you can sort of keep it quiet as you get treatment. And you're talking about doctors and all. Georgia has one of the best recovery systems for impaired physicians in the country. If somebody turns a doctor in, their spouse, a patient, and the doctor will admit that he has a problem, they sort of hold their license, they can't practice, and they go into treatment for at least in-house treatment for at least 3 months. Doctor has to pay for it, so it's expensive. But it really is, and they get intensive counseling. And then after they get out and are successful in the program, there is just real intensive supervision of them in their practices for 5 years. But it saves the community of physicians. And we are so short across this country of physicians that I'm so proud of that program, because we have such a lack of doctors in the state of Georgia, like so many other states. But unfortunately, I see the reports from the nurses. And, nurses are making pretty good livings now. It wasn't like when I started off. My first job, I made $330 a month. And I am not from the dark ages. But, it's not uncommon for, a new nurse to start off at $70,000. There is a huge problem of drug addiction, alcohol addiction among our registered nurses. And the nursing board is not the best to give us information. I wonder what happens to them. And so we have a real problem there functioning with our nursing board also. So we really have it two ways: still denial, all with adults too, but denial about the fact that drugs are in our schools, and the ones that can keep it quiet and get treatment. Probably just like most districts, just maybe a different level of finances, I guess I'm saying.
No, that's true. And this is only a 30-minute podcast. We don't have time to dive too deep on these things, but I would say to an educator, when a superintendent or a principal, a PTA president, these teachers, when they embrace confronting what's going on in the schools, they actually make the schools stronger and protect teachers and students, and it helps the student keep on. I mean, now there's collegiate recovery programs. Kennesaw State University in Georgia has one of the best ones in the nation. So it's not what it used to be when I was in high school in the 80s, which is a scarlet letter for life.
Right.
It's okay to move past that. But you said something so important, and this is a national podcast, but I do want to say something to your point about nurses in Georgia, because I also know this is true in some other states. I know there's going to be an effort in Georgia this year to bring forth some legislation that addresses the disparity that nurses face when they either self-report or get reported, and how can we align that with sort of doctors, if you will, and make sure that there's professional. I don't want to say fairness, but there's a professionalism the way we treat our nurses. And I know you'll be involved in that debate and that discussion. And I know that recovery advocates in Georgia are joining with nursing advocates in Georgia and hospital advocates in Georgia to sort of find unity to earn the trust of the General Assembly to prioritize this. So there'll be a big debate in Georgia this year, and hopefully it's one that will find a path forward for nurses and their patients. So Representative Cooper, you chair one of the most important committees for our community in your state legislature, and you have had countless hours of meetings with families and professionals and survivors like myself. You are truly, an expert on this. But what would you say to another elected official in another state serving in a General Assembly who they don't have a working group on addiction and recovery? They haven't been as active in passing mental health and addiction legislation in their state. What would you say to that elected official as to why it's good policy to start working on mental health and addiction issues in their General Assembly?
I think I would remind them that person's stability and mental health affects their whole life and their productivity and their jobs, or able to go to school and then graduate and move on and become in the future a functioning individual in their state. And so it's something that needs to be protective, and we need to realize what a problem we have and start working on it so that it doesn't destroy lives in our economy and everything about us. We just need to recognize, we talk about it in another way, trying to help children in their formative years get a good background and get a good sense of themselves and their worth and all. Well, when someone gets into drugs or alcohol, that sense of self is often really harmed. And there's a lot of stigma still with it. And the one thing that Georgia has done, and I would say all states need to do, is although the insurance companies were told they had to have parity, that many of them, including Georgia, did not adhere to the national law for until about a year and a half ago, 2 years ago, that we pushed and said, we are going to have parity. It is an illness, just like if you have heart trouble. And we started working on where we were falling down on that. Now, unfortunately, as a state legislator, we only can have real influence on about 12% of the insurance industry, the ones that have practice in Georgia and insure our patients, not the ones that big companies that have ERISA or insurance companies that don't come to Georgia. But we started really pushing for parity and making sure that hospitals were coming up with ways to help people, not just deal with the problem that they had on a temporary basis and then putting them back out again uh, to just come back to the ER again with problems. So uh, I think because your mental wellness affects every aspect of your life, you need to have real stability and a good sense of yourself and not be addicted. Then that's why it's so important to work on it.
I
That's sort
think
of
so.
a roundabout
Yeah.
way. I don't know whether I'd help other legislators with that issue, but I'd certainly be willing, and I am willing to try. I do talk to people at meetings.
No, it is. I make the case that the number one cause of death for Americans 18 to 45 is both. There are two different things medically: overdoses and fentanyl poisonings. I believe deeply those are two different things. And that's a government report. And we get that. But I say government reports, as good as they are, just because it says 18, that doesn't mean 15, 16, 17 aren't impacted.
Right.
That goes through our high schools, that goes through our new families. That's the heart of the workforce in America. And when you look at that, I would make the case to any legislator, to any business leader, that there's no other domestic policy issue that's impacting our economy, that's impacting our families, that's impacting our education system and our legal system, healthcare system more than addiction. And that we may not like it. I don't like it. But it's true. And until we get serious about funding it and finding the right types of laws and rules and regulations versus the wrong types of laws, rules, and regulations,
Right.
at the end of the day, families and businesses and schools are going to be what suffers.
Well, I mean, I think it's the number one cause. Addiction is number one cause, drug addiction, for young men between 18 and about 44. I mean, that's our upcoming workforce. Those are the fathers that are upcoming if they're married. Think about postpartum depression in new mothers, and we have suicides from that, and alcohol abuse, and the ones that came in that were suffering from drug abuse and how it affects the baby. So trying to work with that group. The elderly, they're lonely. That,
Yes.
so often it's not drugs. That may change now because I think drug use became more prominent with our younger old. But alcoholism, it's all through our society.
Oh, it is. Well,
And
the rising demographic is the elderly.
it
It's
is.
and it's prescription drugs, and it is a very serious trend that's developing among our elderly in isolation, misunderstanding. Oftentimes it's unintentional, but overdosing when they're by themselves because
That's
of
right.
prescription. It's a problem. Look, we have time for like one more question. I did want to ask you this because you are a nurse, you have a professional background, you've chaired key committees in your tenure and your service to Georgia, kind of at a 50,000-foot level without diving too deep in the woods. What do you see as one or two areas policy wise where we need to go next on the addiction epidemic? What's ahead for us? What would you like to see states and Congress address?
Well, what I don't know about federally, but for Georgia, we need more professionals that can help people. We do not have enough psychologists, psychiatrists, social workers in this area. So we will now pay off student loans. Uh, we actively recruit. So for our state, getting the professional help that people need. I mean, we say schools needs counselors. The counselors are so overwhelmed in most schools because there's so few of them. They're just trying to help kids take the right courses and so forth, like in high school. But it would really be good to have trained counselors all the way down into grade school. We just don't have them. That would be one of my biggest hopes, that we would fund that. And the other would be I go way back when you could admit people to long term care. Was it abused? Yes, it was. But when the Supreme Court went from people being kept too long and locked up forever, practically, and that did happen. Families used to put a child in a mental hospital because they had seizures. and the family was embarrassed. And they would leave those kids forever. And they would grow up in a mental hospital when we had the big ones. But they went from where we had that to where I said, unless they are an immediate danger to themselves or others, as so often happens, you go from one extreme to the other in government. And that's not where people are. There are people who need more than 2 or 3 days evaluation or a week in a hospital. We have people that have such severe mental illness that they need a longer stay, not forever, but a longer one. And what happened is when we went through this transition, in our state at least, the feds came in and said, you can't put anybody in hospital. So now there seems to be maybe people are realizing that we needed hospitals. They just needed to be run better, and we needed to have parameters where you couldn't let them stay there forever, and they really got help. And we don't have the hospitals anymore. We closed them down. They're gone. And so we don't have an area. I have my heart. I also have a degree in child development and family relations. And we have one of the best hospitals for children in the country. Yeah. And I'm always on CHOA. For years, they didn't treat mental illness. They treat everything else. They finally have an outpatient program for children with mental illness. Now I'm begging for an in-house unit that will allow parents and the doctors to let a really severely mentally ill child have a longer stay in the hospital. And of course, they keep telling me they don't have anybody to run them, no nurses trained, and they can't find nurses, and the doctor run the program and doctors to work. And I have said to them over and over, just go steal them from somebody else. Maybe one of the states that have had a lot of med schools for a lot of time and where we can just go. I said, bring them south, pay them a lot, until we can train our own. So those are the couple things that I would say are really, really important.
I think you're spot on. And unfortunately, our time draws near here, but in the future, I want to get you and a couple of others on to talk about what you just said. We have gone, and I think about this every time I get to go all over the country, and I see in urban areas brothers and sisters of mine that I know are in active addiction, and I know they have mental health issues, and they're just out in the elements. It's not safe for them or anybody else, but it's not just urban America. I see that in suburban America. I see that in rural America. And we have gone from one extreme to the other. And I just want to thank you for recognizing that, because it is something that this country is going to have to confront. How many times are we going to get in our cars and look at people in the elements and on the highways?
Oh,
and just go, oh, well. And so in the future, I hope we can go deep on that. But that's why I'm so honored that you joined us today, because Sharon Cooper, you as a chairman, as a representative, and as just a human being, you lead with a servant's heart. You've helped my community, the addiction recovery community, the mental health community, so much in your home state of Georgia. Thank you for your leadership. And I know that you agree with me. We always say that recovery is real.
That's right. And I do. My concern comes from my heart, and it's why I keep running. I didn't plan to stay this long, but I keep being able to make a difference, to respond to your group and some other groups that might not get heard or get their bills passed. And it's an honor to serve and to be able to help people when they really, really need it. So thank you for having me.
Thank you.